Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a remarkably good day. Remarkably. Today, I'm going to talk about 8 potential signs, symptoms, and observations that may point to the jaw. So this is for those of you that may have chronic issues from the neck and above. It might be that you might actually have jaw issues, whether it's the joint or the muscles around the area. But before we do that, please like, share, subscribe, pass this on to those that you feel this might be helpful for. We want to thank you in advance. So just to sort of give you a bit of a rundown in terms of what we're talking about with the jaw. The jaw is one of my favorite areas to treat, actually. It's and the reason for that is that I've seen some significant changes with patients that have had chronic issues from the neck and above. So this could be that they've had months of potential neck issues, head issues, so on and so forth. And when we treat the jaw, when we figure out it's the jaw, there are big time changes that the person generally feels after treatment. Many individuals, both therapists and patients, sometimes fail to recognize that the jaw may be the root and or exacerbator of one's condition. So what can happen is that the person can come in and say, well, I've got this neck issue or I got this headache, and those are treated locally. So for example, the neck pain, it could be that, there's a lot of focus on the neck, when in fact, the problem is not primarily the neck, it's probably the jaw more so that's causing the chronic issues. The jaw can also mimic certain conditions. So for example, you can get plugging in the ears, you can get headaches, you can get ringing in the ears. So there's a bunch of different things that can happen around the face, head and neck, that it can mimic certain conditions. When treated, though, it can make significant changes to chronic issues. As I mentioned before, it's my favorite, one of my favorite areas to treat. And I have seen some significant changes with these chronic issues. So now let's talk about the 8 potential signs, symptoms, observations that may point to the jaw. Number 1, this is the most obvious one: jaw pain, tightness, and potential difficulty opening the mouth. So, some people will complain about not being able to open their mouths wide to maybe bite down on an apple. In fact, we do have a quick assessment. It's called a 2-knuckle test, where we take 2 knuckles, the patient's 2 knuckles, and they try to put it into their mouth. And if those 2 knuckles don't fit in, generally it means that there could be an issue with the jaw. Number 2, general headaches. So these are headaches that the person feels throughout the day. It might be one of those chronic things that the person gets daily. So that could be pointing towards the jaw. But remember, headaches can be a lot of different things. You got to take a look at everything as a whole in terms of the symptoms and signs, and it can help you point towards the jaw, potentially point towards the jaw. Number 3, a feeling of a tight band around the head. This is a very common one, a very common description in terms of how the person's head might feel. So they'll say that it feels like there's a tight, rubber band that's kind of like around the head, the sensation. And generally, the person may feel it in the morning or sometime in the afternoon. It builds up and they get this sort of tight band around the head. So it's kind of like a headache, but that's the specific sensation that a lot of people will tell me. We're on number 4 now. So symptoms into the ears. For example, plugging is a common one. So, they'll say that one ear feels more plugged up than the other. And when we actually treat the jaw and along with the neck, there seems to be a diminishment in this type of symptom. Now, of course, it depends whether it's actually the ear that's causing the issue or whether there are trigger points in the muscles of the jaw or the neck. Number 5, another common one that people mention to me is that they get eyebrow headaches. So what I mean by eyebrow headaches is that they feel this kind of this pain around the eyebrows. And that could stem from a muscle called the masseter, which is one of the jaw muscles. And when there's a trigger point in that muscle, it can refer into the jaw and up around the eyebrow, kind of like in a letter C fashion, like so. And so people will say, yeah, I get this weird eyebrow headache. So that's another one of those symptoms to be aware of. Number 6, dizziness. So in some extreme cases where there's a lot of tightness in the neck and the head, the person might feel that they get dizziness every once in a while. This is, of course, like, you have to check with your doctor to see if there's nothing else other than muscular. It could be something internal. But if the person comes back, or if the person comes to me and they've had all their checks, they've had their medical procedures done, and they've found negative issues in terms of something internal, then it's potentially the muscles around the jaw and the neck that could be causing some of the dizziness. Number 7, another very common one, chronic neck pain and tightness. In fact, this is one of those things where the person comes to me and tells me they've had this issue for quite a long time. I ask, so you've had treatments on the neck, more local, correct? And they'll usually say yes, that's where the focus is, or on the neck and the shoulders. And then I'll ask if they've ever had their jaws worked on, and generally they say no. So when I work into the jaw, I actually wear gloves, and I actually work internally into the mouth, because there's jaw muscles that are inside the mouth that I have to access. Once the jaw muscles relax, what I do notice is that when I'm feeling the back of the neck, especially, that it softens up quite fast. So it's very fascinating, because like when I work on the neck, it may not give as much. But then when I work on the jaw, there's a lot more give, and the person will generally notice that they've got more movement of the neck, particularly rotation. So chronic neck pain and tightness. So if you've got chronic neck pain and tightness and you've had multiple treatments, it might be a very good idea to get your jaw checked just to see if there's tightness there. And I've got a feeling that if you've had this issue for quite a while, that your jaw might be causing a lot of the neck pain and neck tightness that you're feeling. Finally, number 8, and I put an asterisk beside this because this is not generally a potential sign and symptom, nor can the jaw cause this symptom. So migraines, and I mention it because what I found is that when I treat the jaw, when I work intraorally, again wearing gloves, going into the person's mouth and working into those muscles that are in the mouth, what I found is that patients come back and they tell me that their migraines, they're not as frequent, the duration's not so long, and the intensity has diminished. So I'm not saying that working on the jaw is a cure. I want to underline that it's not a cure, but I think what occurs is that the muscles of the jaw and the neck exacerbate the person's condition because they tighten up. For example, you might start noticing that the migraine's coming on. All of a sudden, you start tightening up some more, so it stresses you out. These muscles become tight, and it adds on to the symptoms. So it adds on to the pain and the discomfort. What the jaw treatment does is it diminishes the muscular component in terms of that added on pain and discomfort. So, and I found some pretty good changes in terms of people and their review in terms of how the migraines feel. And mind you, we're not necessarily treating the migraine. The person might have issues with migraines, but we're treating the person for their neck, for example. So there you go. 8 potential signs, symptoms, and observations that may point to the jaw. If you've got any questions, please feel free to call us at 416-644-8894. That is our phone number at First Canadian Place, King and Bay, Toronto Financial District. That's our office there. You can also email us at admin@ventepainrelief.com. Please like, share, subscribe, pass it on to those if you feel this might be helpful. We want to thank you in advance. My name is Alfie Vente, once again at Vente Pain Relief Clinic and vprc.ca. Again, I'm hoping you're having a remarkably good day. Take care, and we'll see you in the next video.